Cyclosporiasis is on the rise. What can we do about it? I'm Dr. Brian McDonough, KYW Newsradio medical editor. When you talk about the term parasite is something that lives on you or lives on another living object and doesn't give anything back. In other words, it's just taking. There's symbiotic relationships where both benefit. This is one of those. The parasite comes in and just does damage or does whatever it can for itself. So in this case, it's a microscopic parasite, something we can't see, but it gets into your body and it replicates and it starts taking things it wants from your body, but it also causes problems in the person that it has infected. It travels in water. It can be found in fresh fruit. It can be found in lettuce, even now swimming pools, lakes. So you somehow ingest it. And remember, it's microscopic. It's not hard to ingest. You ingest it and it gets into your system. I think you should thoroughly wash, especially things, for whatever reasons, it likes certain things like raspberries, other things. But what we normally see is it's in lettuce, fruits, vegetables. You really got to wash them, and I would wash them aggressively. The other thing is, you reduce the chances. Maybe if you get something from a reputable farmer or something, the more hands that touch this, the more opportunity for cyclospora to be there. So if it's processed in the plant, it goes from here to there and it's at your store. I'd be very careful about washing everything thoroughly, because you're like the last person who gets it, and you can get rid of a lot of it. Obviously, if you cook it, it's destroyed by heat. The problem is the places we're getting it from are things you're not going to cook. You're not going to be heating up lettuce or your vegetables, especially fruits and fresh vegetables. Obviously, if it's a vegetable that you're cooking, you don't have to worry about it. Here's what's tough about it. First of all, it takes a while. We call it prodrome period, but it takes a while for you to even get the symptoms. Some of these things, you go out for a picnic or whatever on July 4th or Memorial Day, Labor Day, and you feel sick within 6-8 hours. You go, oh my gosh, it was the mayonnaise in the salad or something. In this case, it could be like 5-7 days later. So it's hard to track that you had some fresh fruit you picked up somewhere at a friend's house or your own house days before. So it's hard to track it. Then what happens is you get flu-like symptoms. You might get stomach ache, fever, and this diarrhea comes on. It can be explosive. It can dehydrate you, and it can be a problem. But even worse than that, you kind of get through it and you go, oh man, I was really hit with a tough bug. And then it comes back, and it can come back again and again. And if you're someone, your immune system's not as good, you're higher risk, you're very old, very young, it can be a big problem because you get dehydrated faster and it becomes an issue. So that's why we're so concerned about it. One of the things we're doing now is, because we're aware of it as doctors, like in practice, is we're going to test for it. We normally don't run routine tests for cyclospora. It's not something we're really thinking about, but because we know this, you can test for it. But as far as treatments, there's a drug called trimethoprim sulfa. Brand names are Bactrim, Septra. It's a medication, it's out there. It's not that expensive. It's something you can get. That medication can treat it. So if you're a physician or healthcare provider thinks that you have this, it's worth, first of all, they will treat you. But also, if you're having a problem, talk to your doctor, get in there, get seen, because you don't want it to continue. And again, if you get through something in 2 days, maybe you just sit back and say, I'm lucky. But if it comes back, I would not go through a second round without a doubt, without seeing somebody. And if you have explosive diarrhea, you're losing fluids, you want to get seen right away, even if it's the first pass. It's hard to tell. We can't really predict the future. I would expect it to get worse before it gets better, because we're still in the middle of the summer. Usually these things play out. We're not really getting the data that we need on the front end. So it's hard to tell. One of the ways, for instance, we attack the flu is we know there's going to be certain strains of the flu coming. So we build vaccines to go after the flu strains that are coming as they come across the world. And that's how we protect ourselves. We're not always right, but we can do that. COVID, same thing. What strains are out there? If you don't get the early information, then you have flawed treatments. So that's kind of where we are. We need to be more aware of what's happening. And maybe we're learning lessons from this. Maybe, people at CDC and other organizations are going to kind of rise up and say, we got to do this for people's care. I know a lot of public health people are out there speaking. I think we're seeing a lot of things this summer and this season which are much more aggressive than they've been in the past. I mean, if you look at cuts and things, and as far as testing and finding out and looking for things, we often can detect these problems early in the past, and they don't get out there. But think about it. Look at the record numbers of measles cases. We're talking about cyclospora, this screwworm in animals. All these things are out there. And what's happening is we're not catching them early because we're not doing the due diligence early. We're kind of letting it flow. Once it's out there, that's when you start people having symptoms. So there is a real value. I can't stress this enough. Public health is where we've made our major advances in the last 3-4 decades. If we don't continue to take care of our people through public health, what we're going to get is what we expect. Organisms like this, parasites, they don't have a budget. They just come after you. So they don't know if there's been cuts. They just go, hey, I have an opportunity. A parasite's going to be a parasite. So cyclospora is going to go as many people as it can in as many ways. And if we're not testing it early or detecting it by testing our fruits, vegetable, those things early on, it's going to get out there. So what we're seeing, sadly, is more and more of these things happening. And I think we're just at the tip of the iceberg. Things that you talk about we didn't really think about. Honestly, I don't worry about cyclospora that much in the past either. I'm not thinking about the common things. Well, we're going to have new common things. And my other concern is people traveling from afar coming into the country. If we're not testing things, we could get things that are tropical and exotic. And, and fortunately, we can go after this, and we're trying to warn people. But really, this could have been done a lot earlier. Have a question for me? Just reach out at askdrbrian@kywnewsradio.com.